Good day, everyone. We are the Group 2, consists of De Guzman, Gumasing, Lapada, Lotero, Meneses, and Rosel. So the title of our study is Level of Awareness Among Adolescents ages 15 to 19 years old regarding home oral care in Manila Central University. Chapter 1, Introduction. Oral health is fundamental to overall health, well-being, and quality of life. A healthy mouth enables people to eat, speak, and socialize without pain, discomfort, or embarrassment. Pain from untreated dental diseases can lead to eating, sleeping, speaking, and learning problems in children and adolescents, which affect a child's social interactions, school achievement, general health, and quality of life. Rampant dental caries in children adversely affect the overall nutrition necessary for the growth of the body, specifically body weight and height. That begins with the first bite and chewing the food efficiently. The objectives of the study aims to determine the extent of awareness level of adolescents regarding home oral care, and the study aims to help increase the awareness of adolescents regarding home oral care. Number one, what is the demographic profile of the respondents in terms of age, gender, and grade level? Number two, what is the awareness of the respondents regarding home oral care? What are the dental treatments that the respondents underwent? And is there a significant relationship between the dental history of the respondents and their profile regarding the age, gender, and grade level? Research hypothesis number one, there is no significant relationship between the home oral care awareness of the respondents and their profile. And number two, there is no significant difference between the dental history of the patient and their level of awareness to home oral care. For the theoretical framework, the biophysiosocial model of health and illness is a framework developed by George L. Engel that states that interactions between biological, physiological, and social factors determine the cause, manifestation, and outcome of wellness and disease. Historically, popular theories like the nature versus nature debate posted that any one of these factors was sufficient to change the course of development. The biophysiosocial model argues that any one factor is not sufficient. It is the interplay between people's genetic makeup, dental health and behavior, and social and cultural contexts that determine the course of their health-related outcomes. Health promotion must address all three factors as growing body of empirical literature suggests that it is the combination of health status, perceptions of health, and sociocultural barriers to assessing healthcare that influence the likelihood of a patient engaging in health-promoting behaviors like talking medication, proper diet or nutrition, and engaging in physical activity. The conceptual framework, it includes the input, process, and output. In input, the socio-demographic factors includes the gender, age, and grade level, as well as home oral care and dental history. The process, self-assessment of respondents in terms of home oral care, and for the output, level of awareness among adolescents ages 15 to 19 years old regarding home oral care in Manila Central University. In figure number 3, it is the framework of oral hygiene based on the biophysiosocial model of health.
Significance of the study. To the adolescents, the study will be conducted to expand the awareness and knowledge of adolescents from Manila Central University. To the parents, the said research will give awareness to the parents regarding the reasons that would affect the oral status of their sons and daughters. As soon as the parents are already aware and informed, they can guide their children in protecting their teeth from dental problems. To the practitioners, the outcome of the study will help practitioners understand an individual's certain oral condition. Awareness about the factors affecting the individual's home oral care will lead the practitioners to make something out of it, such as giving advice and discussing the benefits and consequences of proper oral care. To the teachers and school administration, this research will benefit the school as it is concerned about the school students' oral health. Furthermore, they can learn from the statistical data gathered regarding oral health awareness. To the future researchers, the study will serve as the future researchers' guide and basis of their research making as well as a reliable source of information for their research. Scope and delimitation. The entire study will focus on the level of awareness among adolescents ages 15 to 19 years old regarding home oral care in Manila Central University, Caloocan City, which will be conducted during the first semester of academic year 2021 to 2022 of Doctor of Dental Medicine at Manila Central University. The study used a survey questionnaire intended for the students to answer the questions formulated. The study specifically dealt on the profiles of respondents such as age, gender, and their grade level. It will not provide treatment for the respondents but will raise their awareness about oral health. The researchers will not consider influence, community, or friends. For the Chapter 2, review of related literature, foreign setting, having a good oral care routine is one of the more personal things we practice as part of everyday self-care. Taking care of our teeth, gums, and mouth contributes directly not just to our bright, beautiful smiles, but more importantly to our overall health. Good oral health care keeps plaque and bacteria that lead to plaque and tooth decay under control. Local studies, oral health is recognized as an integral and indivisible component of every Filipino's total health since nourishment begins in the oral cavity. However, it is usually ranked in an individual's priority. The National Monitoring and Evaluation Dental Survey, or NMES, conducted by the Department of Health in 2011, shows that the prevalence of dental caries or cavities among Filipinos is 87.4%, while 48.3% for periodontal disease.
To continue the discussion, here I will talk about the chapter 3 research methodology. So here we have the purpose of the research studies to describe the level of awareness among adolescents ages 15 to 19 years old regarding home oral care in Manila Central University, Caloocan City. Hence, this chapter presents the methods and procedures that were used in the research study. Data gathering will be accomplished through a self-made research questionnaire by the researcher. The gathered data will be analyzed and organized according to the profile of the respondents, including the grade level, age, and gender. The research design, the type of research that the researchers utilized in this study is qualitative research. The researchers utilized a descriptive method to get a better understanding of the gathered data from the adolescents ages 15 to 19 in Manila Central University through Google Form survey. The research locale is in Caloocan City, Metro Manila, Philippines, specifically U at Basic Education Department, since the study's respondents and direct recipients are the adolescents ages 15 to 19 from Basic Education Department. For the research sampling technique, the research sampling method that the researchers will be using is non-probability sampling methods, wherein the respondents are selected based on non-random criteria. As per research, the respondent should be a MCU student who ages 15 to 19. The technique is mainly used in exploratory and qualitative research that aims to develop an initial understanding of a research population. Snowball sampling will be used since there is no pre-calculated list of target population details. The ethical considerations for involving human in research include the need for full disclosure of the purpose of the study and the assurance of confidentiality and voluntary participation. The involvement of participants in this study was done on a voluntary basis. Filling out the names are optional to secure the identity of the participants. In an instance where names and names of guardians are provided, it will be confidential and only the researchers can see them. All indicators to identify the participants were removed from the report. So the last portion of the chapter 3 research methodology is the data gathering procedure, which here you can see the flowchart that illustrates how we conducted our study. So first, we determined the level of awareness among adolescents ages 15 to 19 regarding home oral care in MCU, then formulate the survey questionnaire in Google Forms, distribute the questionnaire to the set criterion, and input the survey result to SPSS Statistics version 26. The next is we analyze and examine the data gathered throughout the entire survey and state the fact and result only. Formulate the conclusion, and last, we summarize or generalize the data.
And for the chapter 4, analysis and presentation of biographic data. This section of the questionnaire includes the age, gender, and grade level of the students. To secure the identity of the respondents, filling out names and the names of the guardians will be optional. And in an instance where the names and the names of the guardian are provided, it will be confidential and only the researchers can see them. And for the respondents' age, the researchers conducted a survey to the adolescents ages 15 to 19 years old. Among the 71 respondents, most gathered data are coming from the age group of 17 years old, with a total of 26 respondents and the percentage of 36.6. Meanwhile, the least data gathered are from the age group of 15 years old, having gender is the respondent's gender is from the 73 students of junior and senior high school students of Manila Central University. Females are the leading participants who answered the questionnaires with a percentage of 65.8% and 54.2% for the males. And for the respondents' grade level, the researchers include the 4 levels of high school department in Manila Central University, from grade 9, grade 10, grade 11, and grade 12. Among these 4 levels, the highest level of participants who answered the questionnaires are grade 11 with a percentage of 60.3%, followed by grade 12 with 30.1%, and grade 10 with 8.2%. And the least percentage is grade 9 with only 1.4%.
So in this portion, these are the correlation of one of our variables and one of our questions. So in this table, the correlation of age and how important do you think the health of your mouth is. So in this table, all the 15 years old and 18 years old respondents thinks that their oral health is very important, followed by the age group of 19 years old, wherein 93.3% thinks that their oral health is very important as well. And one individual of this age group thinks that it is somewhat important in the age group of 17 years old. 88.5% agree that oral health is very important. 11.3% of this age group thinks that the oral health is somewhat important, and 1.4% don't know the importance of his or her oral health. So next is, are the age and are there any untreated conditions in your mouth? So in this table, 75% of the 15 years old age group are aware that there are any untreated conditions in their mouth, while 8.3% up to 27.8% of the rest of the age group answered yes, that there are untreated conditions in their mouth. And majority of the ages, 16, 17, 18, and 19 years old, thinks that there are no untreated condition in their mouth. So next. So next question is age and how often do you visit your dentist? So in this table, 50% of the 18 years old respondents visit their dentist monthly. 25% visits their dentist once a year, and another 25% of this group, age group only visits their dentist while pain discomfort is experienced. Followed by the age group of 15 years old, wherein 25% visits their dentist monthly. 25% of the respondents visit once a year, and majority of this age group visit only pain and discomfort experience, which is 50% of this group. Majority of the age group of 16 years old only visits when pain or discomfort is experienced. So then 22.2% visits monthly, and 22.2% also visits twice a year. For the 17 years old, majority of them also visits when pain and discomfort exist, which is 42.3%. So furthermore, 26.9% of this age group visits twice a year, and 15.4% visits once a year. 7.7% visits monthly, and 7.7% also is in this age group never visits dental clinic ever. So lastly, 40% of 19 years old only visits their dentist when pain and discomfort is experienced, and one individual visits monthly, and 26.7% for twice a year and once a year. Have you experienced any form of dental education correlates in age? So this 75% of the 15 years old have experienced dental health education. 61.1% within age 16 have experienced dental health education, and 61.5% for age group of 17 years old, and 87.5% for 18 years old. And lastly, 73.3% for 19 years old also acquired dental education. So next is age and how often do you brush your teeth? For the age group of 15 years old, one individual brushes his or her teeth every morning. One brushes his or her teeth before bed, and one individual brushes his or her teeth twice a day, and then one individual brushes his or her teeth every afternoon. For 16 years old, majority of them brushes their teeth twice a day, which is 66.7%. Then some before bed, which is 22.2%. While 5.6% of every morning and every afternoon. For 17 years old, the majority of the respondents brushes their teeth twice a day with a percentage of 69.2%, and while 75% of the 18 years old brushes their teeth twice a day. So lastly, 73.3% of the 19 years old brushes their teeth twice a day. Next table is the correlation of age and what method do you use to clean your teeth. 100% of all the age group uses brush and paste to clean their teeth. 50% of the 15 and 18 years old also use dental floss to clean their teeth aside from brush and paste. Only about 4 and 18 uses dental floss, about 22.2% for 16 years old, and 7 out of 26, which is 26.9% respondents of 17 years old uses dental floss aside from using brush and paste. 4 out of 15 within 19 years old uses dental floss in addition to brush and paste or paste to clean their teeth. Lastly, the correlation of two questions: how often do you visit your dentist, and how often do you brush your teeth? So, for those who visit their dentist monthly, 41.7% of them brushes their teeth twice a day, and 25% brushes their teeth every after meal for those who visit their dentist twice a year. Majority brushes their teeth twice a day within percentage of 93.3%. Only one individual brushes their teeth every morning in this category. For those who visit their dentist once a year, 2 individuals brushes their teeth once a day. 63.6% of them brushes their teeth twice a day, and 2 individuals brushes their teeth every afternoon. For those who only visit their dentist when pain and discomfort is experienced, 63.3% brushes their teeth twice a day, and 26.7% brushes their teeth once a day. and 10% of which brushes their teeth every other meal. Lastly, 100% of those individuals who never visits dental clinic brushes their teeth twice a day. So next.
Recommendation. For the summary, based on the data given, 87.3% of the respondents think that their oral health is very important, whereas 42.3% of the respondents only visit their dentist when there's pain or discomfort being experienced. All of the students brush their teeth regularly, but only 29.57% of the respondents use dental floss in addition to toothbrushing. 67.6% of the respondents brush their teeth twice a day, and only 11.3% of them brush their teeth every after meal. For the conclusion, the researchers concluded that the age of the respondents doesn't affect their level of awareness with regards to home oral care, whereas some of the younger respondents have higher level of awareness compared to the older respondents, especially when the respondents have orthodontic braces and visits their dentist monthly for an adjustments. Nevertheless, the second hypothesis of the researchers stated in the chapter 1 of the study contradicted to the data gathered, for they hypothesized that there is no significant difference between the dental history of the patient and their level of awareness to home oral care, whereas the study result showed patients with lesser frequency of dental experience are less aware to home oral care than patients with most dental experience, as they are encouraged and frequently reminded of proper oral home care. Recommendation to the parents. The researchers recommend the parents to guide and monitor their children's oral health, as it is fundamental to one's overall health, well-being, and quality of life. Parents can provide the necessary and basic skills about oral health care to children and also help in the early detection of oral diseases. To dental students may provide useful information to the adolescents regarding oral health care without making it complicated. Dental students can educate everyone the proper home oral care and to still seek a dentist not only when discomfort or pain is experienced, but also for a regular checkup and cleaning. To the dentist or dental health care providers, it is important that dentists or dental healthcare personnel should teach the patients on how proper toothbrushing and flossing is done, including the frequency of its use. The school and administration. Teachers contribute significantly to the planning and implementation of preventive oral health programs. They must encourage their students in every way to take care of their oral health. The future researchers. The researchers recommend this research paper as a guide to the future researchers who will be conducting an inquiry in line to this topic. The researchers recommend to conduct the same kind of study to give another information that will be useful to others. In line to this, the researchers are open for the improvement of the study, such conducting study to a wider scope of respondents to increase the validity and reliability of the study. Discussion. Teaching minors the proper oral hygiene is one way of preventing any oral disease from developing that can cause further problems in the future. Brushing after meals is a basic step to proper oral hygiene. Minors can have etiquettes to themselves that after every meal and before going to bed should be followed by oral brushing and flossing. The importance of flossing is by removing food particles and preventing plaque from building up. Flossing each day may reduce your risk of tooth decay and gum disease. Flossing can also prevent food from decaying between your teeth, which in turn may help prevent bad breath. Brushing teeth after meals will remove plaque, food debris, and a sticky white film that forms in your teeth that contains bacteria. Eating and dietary habits can also be a factor in oral health. Eating foods with heavy amount of sugar can be a serious threat to the teeth. Visiting a dental hygienist and dentist can be a help, especially for the people who lack oral health care. Dental plaque or any oral problems cannot be removed fully. That is why visiting dental professionals at least twice a year will benefit us such to achieve a good oral care.